Hello and welcome again. So now we are again moving forward from coronary bacterium diphtheria to Listeria monocytogenes, which is again a gram-positive bacilli, that is gram-positive and aerobic. So we have talked about the bacillus, we have talked about the coronary bacterium diphtheria, we have talked about the Listeria. These are the gram-positive aerobic bacilli. Then we have talked about the Clostridium, which was gram-positive anaerobic bacilli. Okay. Listeria monocytogenes is one of the important bug that is usually get contaminated. We get infected with this bug when we have this bacteria when we are consuming some of the contaminated food, and if we are immunocompromised, then it may develop the meningitis in case of the older people and immunocompromised people, and the patient usually doesn't get well with this cephalosporin, the usual antibiotic of meningitis, and patient die or have a neurological complication. So identification of the organism is very important for the appropriate treatment. Otherwise there will be a complication, like there will be a neurological deficit or patient may die. There are the other symptoms and other disease as well. So let's begin again. This is the gram-positive facultative intracellular rot. This facultative means organism that can live inside, can maybe live outside. Obligate intracellular means they will only survive inside the cell. Facultative means they can survive outside and inside as well. But since it is a facultative, it has a mechanism to survive intracellularly, and because of that, since organism is inside the cell, the humoral antibody, the humoral immunity will not able to kill this organism. It will bypass the humoral antibody mechanism, and because of that, the infection usually we get infection easily, and we develop the disease easily. Okay, so there will be no protective from the antibody mediated, humoral antibody mediated. Okay, so facultative intracellular rot acquired by ingestion of unpasteurized dairy product and cold dairy meat, transplant transmission, or by vaginal transmission during birth. So we can see this can be, we get contaminated with we get infection by ingestion of contaminated food like unpasteurized dairy products and other cold dairy meats. This can be the source of infection, source of this bacteria. It can even transfer actually. It can even transfer from the mother to the baby. So through placenta, it can goes to the baby, and in baby they can cause sepsis or say meningitis and others, death even. Okay, they can even be transmitted during vaginal delivery. So during vaginal delivery, when baby is born, they can aspirate this bacteria, and then they can get infected and develop meningitis and other symptoms, other diseases as well. Okay. So grows well at refrigerated temperature. The important point is we usually think that bacteria get killed at the low temperature, but here at this in the freeze, in refrigerated, they can survive for a longer period of time. They have an interesting cheese is the forms the rocket tails. You can see over there, this is the bacteria and a rocket tails red in A, that via actin polymerization that allows the intracellular movement and cell to cell spread across the cell membrane. So this bacteria actually has what? This has the rocket tails that helps in the transmission, the movement from one cell to another cell intracellularly, and that help them to escape from the humoral antibody mechanism. So you have to again understand they are talking about this rocket tail appearance, that is active polymerization that allow intracellular movement and cell to cell spread across the cell membrane, therefore avoiding the antibody mediated killing or antibody mediated mechanism. Characteristic tumbling motility in broth. When you grow this organism, in the growth organism there will be the tumbling motility, just like it will be torn one and around. So this is called a tumbling motility. So it can cause amnionitis, septicemia, spontaneous abortion in the pregnant patient, granulomatous infantisepticemia, meningitis in immunocompromised patient, neonates and older adult, mild self and limited gastroenteritis in healthy individual. The treatment option is ampicillin. So there are the tons of diseases like amnionitis, septicemia, spontaneous abortion in pregnant patient, granulomatous infantiseptica, meningitis in immunocompromised patient, neonates and older adults. So it can cause meningitis in immunocompromised neonates and older adults. And there are some like mild and self-limited gastroenteritis in healthy individual. The treatment is simple, that is ampicillin. show you some of the thing. So this is the, see, this is the Listeria monocytogenes bacteria, gram positive one. It can move intracellularly from one to cell another, so it doesn't need to come outside. If it is not coming outside, then it will not be killed by the humoral antibody. The antibody mediated antibody will not able to kill this. Okay, so diagnosis. Usually when bacterial culture, in a normal bacterial culture, you can grow this organism, and in grow then from like tissue fluid, blood, spinal fluid or placenta, and treat with the simple antibiotic like ampicillin. Ampicillin is a drug of choice that you have to understand. It has a symptom like fever, headache, diarrhea, abdominal ache, nausea, muscle and fatigue. They can develop lots of symptoms. Okay, if you see what are the infection caused by eating food contaminated with the bacterial Listeria monocytosis, that can affect the pregnant woman. Listeria can pass from the pregnant woman to their fetus and newborn. They can cause to the weak immune system, older adult, and develop septicemia, meningitis and death. That is the risk factor. Food are the raw food, soft cheese, smoked food, raw milk, meat, hot dogs can affect the chest, abdomen, bone and joint as well. Okay, so what is Listeria? Listeria is the serious infection caused by the germ Listeria monocytogenes. Usually become ill with the listeriosis after eating contaminated food. This disease primarily affect the pregnant women, newborn, older adults, people with weak immune system. The treatment is very simple. Ampicillin. The characteristic feature is it has tumbling motility. It can spread from one to another cell intracellularly, so they doesn't need to come out of the cell to get the patient infected. Okay, so that makes them very high yield point of view. Okay. So in a nutshell, we can remember this Listeria monocytogenes is a gram-positive bacteria that can move intracellularly. It's a facultative intracellularly. So escape from the humoral antibody, and mainly cause the disease to the pregnant woman, and immunocompromised in a newborn or older people. Immunocompromised, they develop meningitis and may cause the death. They can have other diseases as well, like amnionitis, septicemia in spontaneous when the pregnant patient, granulomatous intracentrica, and mainly the meningitis in immunocompromised neonates and older. There are only limited gastrointestinal infection. So this is although simple, but a question can be asked about Listeria monocytogenes. Thank you.